Okay, this is going to be a quick video on AEC, which is Automatic Exposure Control. This is the control panel in room 1, and I want to show you a few features that we have. So we have the little AEC device down here in the corner. You actually have to turn this device off and on based on what body part you're doing. You can select these chambers. You can select 1, 2, or all 3, depending on which ones you want to use. You will select based on exam you are doing. The most important thing to remember with AEC is how things change as you change this AEC device. The purpose of AEC is to maintain density. So no matter what changes are made, your computer will figure out in the background what has been changed and make accommodations to fix that. So if you adjust KVP or MA, or if you adjust your density setting, it will adjust your length of exposure in order to compensate for that. The only thing that your AEC device controls is your length of exposure. Everything else is set by the technologist. So for the most part, this can be used as a device when you don't know a general technique to use in order to get your mass setting and have the machine help you out to get adequate density. You can use it to set based on your part. So if I'm selecting a lateral lumbar or AP lumbar, it will tell you what KVP, what MA, what density setting, and also what AEC chamber to use. And this is preset. You can make modifications to this if you wish, but it's preset based on an average size patient. I can change my density setting by increasing this control panel here, or I can decrease it by changing it to the minus. The N stands for normal or average density for average size patient. This density setting is different based on the vendor. Some of them go in percentages, like this one here. Some of them increase by like +1 or +2. So depending on what vendor you have, this will vary greatly. So this is something you will learn when you get to your site and depend on the room that you're using at that time. So for the most part, the most important thing and probably the hardest thing for students to take on and learn is understanding what changes as you change KVP or MA or your SID or your density setting. So if you remember that the whole purpose of AEC is to maintain density, you should think in your head, how is the machine going to do that to compensate for the change? For example, if I increase KVP, that means that I have higher KVP, and in order to maintain density, I can have lower mass. Since MA is already preset and there's no time set, the only way to adjust mass is for the machine to have a shorter time in order to make that a lower mass. If I decrease MA in order to maintain density, think of the rule of reciprocity, my machine will have to increase the length of exposure time in order to compensate and maintain density. If I increase SID, I'm getting farther from the source. My machine is going to be, of course, less intense, so I need to have longer exposure time to maintain density to make up for that additional mass. The only way to actually change density is to use the density setting, and that's why it is called the density setting. So if I want to increase density from the average patient, say my patient is 1 times larger than the average patient, I could go up +15%. If they're 2 times larger, I can go up 30%, or if I have control panel that is +1 or +2. If my patient is smaller than the average size patient, I can decrease it down to -15 or -30. So the density setting is the only way to actually change the density. Any changes other than density setting, the machine will make changes to maintain density so that the density will not increase or decrease on your image. That's a very important factor to know. So for the most part, you will have to learn your vendor, learn how to turn the chambers on and off, learn how to select the chambers based on what anatomy you're doing, and understand what's going on in the background as you make those changes. For the most part, your control panels will be preset based on your anatomically programmed anatomy, based on if it's an AP, a lateral, it will have it pre-programmed, and you can modify it from that point. So just know that you can make modifications. You are not locked in to this set setting. For example, I can toggle these squares on and off and make changes if I see fit. This is based on an average size patient that's done on the table. So if, for example, I can only use the AEC if I'm using a bucky. The AEC device is below the table, above the bucky. So I can only use this device if I'm using the table or the upright bucky. So for example, if I'm doing a patient and I typically would have them on their back and facing the ceiling, if for some reason I had to modify the exam, I could modify the chambers based on where that anatomy is lying in order to accommodate the patient. So for the most part, this is just a rough overview of AEC using the control panel, just so you have that information. And we will still cover a lecture point on this to cover all of the individual key points of AEC, and when we do that, we'll do it by Zoom, and we'll be able to have interactive discussion along with that.